First, we always want to start with our behavioral strategies before we go necessarily down a medication route. But just to keep in the back of your mind, there are a couple different medication options, one of which is fairly commonly used and is available over the counter called melatonin. There are some prescription options that some pediatricians might prescribe. So if you're kind of at that point where you feel like you need to really get your child to fall asleep because they're not sleeping at all or they're sleeping very little, which has many downstream effects on behavior and also just the family in general, consider talking to your pediatrician. So a few different things to start out with trying is, of course, having a really good bedtime routine that is very calming and does not involve screens to the extent that you can prevent that. We also want children to try to fall asleep in their own room, in their own bed, to the extent possible. As soon as we start introducing other variables into that, it gets more and more difficult for children to fall asleep. So